Case Study 1, Diane. First examining Diane's servings according to the Eat for Health dietary guidelines, it is evident that she is consuming enough fruit, dairy, and lean meat equivalents. However, while she meets the recommended intake for the meat category, it may not necessarily include sufficient red meat, which we'll discuss further in the presentation. Diane needs to increase her intake of vegetables, cereals, grains, and limit her discretionary foods, which are commonly neglected. Additionally, Diane is not drinking enough water, a crucial yet often overlooked aspect of nutrition. Regarding Diane's macronutrient breakdown, she is not getting enough protein in her diet despite meeting the lean meat equivalent recommendations. This shortfall is due to her overall energy intake being 9,000 kilojoules, whereas the Eat for Health guidelines suggest she needs 11,600 kilojoules. The two issues I see with Diane's current lifestyle are her energy balance and nutritional deficiencies. The combination of amenorrhea, as stated by Diane, fatigue, irritability, and concentration difficulties suggests that Diane might be suffering from the relative energy deficiency in sport, REDS, previously known as the female athlete triad. This condition occurs when there is an imbalance between dietary energy intake and the energy expenditure required for health, daily living, growth, and sporting activities. As I would consider Diane a semi-pro athlete, and as a female, she is at risk of iron deficiency due to increased loss through menstruation, although not currently present, sweating, and the high demands of her sport and cleaning position. Diane's potential iron deficiency, which can cause fatigue and impaired cognitive function. Insufficient intake of essential vitamins and minerals, e.g. calcium, vitamin D, B vitamins from her lack of vegetables, can also contribute to the symptoms Diane is experiencing. To assist Diane to continue with her busy and taxing schedule, I would suggest she works with a sports dietitian. They can provide a more in-depth assessment of her current dietary intake and ensure she is consuming sufficient calories and nutrients to meet her energy demands. I'd also like Diane to incorporate rest days and proper recovery protocols post-training. Diane's amenorrhea is concerning, and I suggest she sees a healthcare provider to assess for conditions such as hypothyroidism and other hormonal imbalances. Similar to Diane, Tommy is consuming enough fruit, dairy, and lean meat equivalents, but is not eating enough vegetables to obtain the essential vitamins, minerals, and antioxidants that support heart health. Tommy's current intake is 18,000 kilojoules per day, while it is recommended that he consumes roughly 16,300 per day. This excess puts Tommy on a path to gaining more weight, despite already having a body fat percentage of 22%. His macronutrient distribution is 60% carbohydrates, 10% protein, and 30% fats. The 10% protein is too low, which I'll discuss shortly. Additionally, Tommy's 30% fat intake may be high due to his excessive discretionary food choices, with 5 servings per day being above the recommended amount for any individual. I have significant cardiovascular health concerns for Tommy. His father had a heart attack at age 50, which significantly increases Tommy's risk of developing heart disease. Family history is a strong predictor of cardiovascular issues. This is compounded with Tommy's waist-to-hip ratio of 1.0. Central obesity is linked to an increased risk of atherosclerosis, hypertension, and insulin resistance, all of which contribute to heart disease. Tommy is consuming 18,000 kilojoules per day, which is above his estimated daily requirement. This caloric surplus is likely contributing to weight gain. Continuous weight gain can also lead to obesity-related conditions such as type 2 diabetes and hypertension. For Tommy, I recommend managing his cardiovascular health and weight He should visit an allied health professional to monitor cardiovascular health markers such as blood pressure, cholesterol levels, and glucose levels. He should also adjust his caloric intake to align with his estimated needs of 16,000 kilojoules per day. This can help prevent further weight gain and support gradual weight loss. I would also increase his protein intake to at least 15 to 20% of his total daily calories. I would also like to see Tommy move more daily by integrating physical activity into his routine, such as taking the stairs, walking, or biking to work, and also including breaks from studies. We can also improve this further by recommending that Tommy sees a personal trainer to guide his strength training. Back to Diane and looking at her supplementation. Given Diane's symptoms of fatigue, irritability, and concentration difficulties, alongside the high energy demands of her sport, she may be at risk of iron deficiency, which is common among female athletes. I would like to see Diane consider iron supplementation, or even just include more iron in her diet. As a state-level soccer midfielder, Diane engages in high-intensity activities that require both aerobic and anaerobic endurance. Beta-alanine is an ergogenic aid that can enhance her performance by improving her muscular endurance and reduce fatigue during high-intensity efforts. Looking at the Australian Institute of Sport, she needs to review the supplement and seek professional advice to make sure she's not consuming a prohibited amount. Thank you.